accessible, value-directed, and excellent, safe health care throughout North Carolina by modernizing nursing regulations. This bill has had many years of work coming together, many opportunities, and we've brought together an incredible group that's come out today and is supporting this bill, and many new organizations that are now on board. I wanted to give a quick overview of where the bill is. There's some other members you need to hear from in this process. Simply, other than updating clear definitions for advanced practice nurses, this bill will establish a clearly defined license process for advanced practice nurses and provide title protections for 4 roles: clinical nurse specialist, certified and registered nurse anesthetist, nurse midwives, and nurse practitioners. It will also eliminate the dual joint regulation and therefore authorize the Board of Nursing to regulate all 4 roles of APRN. It will eliminate the requirement for collective practice agreements with a supervising physician for nurse practitioners and certified nurse midwives. Communication between MPs or CNMs and supervising physician is required now only once every 6 months. These contacts add cost to the healthcare system with no evidence of improving patient care. Collaborative practice agreements are not required for anesthetists. And finally, we'll say it is important to note that this does not change the scope of practice for nurses. This does not change any of the activities they are currently doing, just the regulation and manner in which they can perform their work. For me, this bill really started back when I was mayor, and Golden Leaf had granted the town of Spruce Pine $500,000 to recruit a physician to North Carolina, to Western North Carolina. Quite frankly, after a year, $500,000 wasn't enough to add a single physician to our hospitals. Rural Western North Carolina, all of rural North Carolina, struggles with getting practitioners in the state. There's been a lot of conversation about who does what procedures and whether or not that should be the role of someone under a physician supervision or not. I will tell you, for Western North Carolina that I represent, it's not a question of who does a procedure, it's whether a procedure is done. Most of the counties I represent, you will find that from 5 p.m. on Friday till 9 a.m. on Monday morning, your only option for health care is the emergency room. So coming in, because we can't open clinics, because we don't have doctors to fill in the supervisory roles to run the clinics, and the ability to actually go see one who can make a determination whether you need to be at the emergency room or whether this is something that can be simply treated. This puts that in place and allows those individuals to operate and run their own businesses in those processes. Most the hospitals I represent don't have an anesthesiologist on staff. It's been run by nurse anesthetists for many years. Nurse practitioners fill these roles in doctors' offices all over the state. This just allows them to expand. More physicians, this was 2 years ago from the SHEP, more physicians pass away and retire each year in the state of North Carolina than graduate from our medical schools. As our population ages, as our population continues to grow, if we are going to provide health care in this state, nurses have to be the answer to be able to move us forward. And with that said, I want to recognize Representative Josh Dobson, if he would like to come up and say it.
Thank you, Senator Heiss. Thank you all for being here today. First, I want to say thank you to all the nurses that have provided grassroots support for this important issue. Also would like to thank the Association of Home and Hospice Care North Carolina, Carolina Center for Hospice and End-of-Life Care for their support as well, many other groups that you're going to hear from. Finally, my other primary sponsors. It's a bipartisan piece of legislation. Representative Lambeth, Representative Stevens, Representative Adcock for their tireless work on this issue over many years. For the last 4 years especially, I've worked almost exclusively on access to care issues in underserved areas like mine. I've learned that there's no silver bullet to fix all the health care issues in our state. It has to be a comprehensive approach to solve these big problems that we have. One way we can work to solve those problems is by passing the SAVE Act, House Bill 185 or the Senate Companion Bill. Passing this legislation would remove the outdated and burdensome regulations that prevent APRNs from practicing to the fullest extent of their training, and would go a long way in improving access to care in areas like mine without jeopardizing quality of care. The evidence has shown time and time again that quality of care is not put into question when access to care is expanded. The high cost of health care continues to be an issue throughout our state, both urban and rural. Once again, the evidence has shown that by allowing nurse anesthetists, nurse practitioners, nurse midwives, and clinical nurse specialists to practice without burdensome regulations, health care costs would be forced to go down. I'm proud to be part of this legislation. I look forward to working tirelessly with Senator Heiss and nurses across this state to see this important bill become law. And at this time, I'd like to recognize Charnel Fuller Cooper with AARP.
Good afternoon. I'm Charmaine Fuller Cooper with AARP, and on behalf of our 1.1 million members in North Carolina and a growing aging population, we're happy to stand in support of this bill today. With a shortage of providers throughout the state, which is getting worse as our baby boomers age and retire, we have an important decision to make today in North Carolina. North Carolina's aging population cannot afford to wait weeks or months to see a physician. Currently, it's too common for a trip to the doctor to become a full-day event, as our member Dwight Willis said today when visiting a legislator. People do it every single day throughout North Carolina, from Brunswick County to Vance County to Clay County and even in Spruce Pine. Nurses are the most trusted profession in this country and in our state, and we trust nurses to give us the care that we need. The aging population has complex needs and many chronic conditions, and we believe that APRNs are ideally suited to care for North Carolina's 50-plus population and our families. AARP supports this legislation, and we appreciate other consumer groups in this room who back our efforts, including the North Carolina Assisted Living Association.
I'm Representative Gail Adcock. Thank you so much for being here today. Those of you who've been around for more than one session know that you've seen a bill like this before, and you may be sitting there thinking to yourself, oh my goodness, not the same old battle. So let me just say right on the front end, this is a battle, but it's not a turf battle between APRNs and physicians. I'm not saying it's not about money, but I'll get to that in a minute. This is a battle to remove barriers to health care that have existed for more than 40 years for nurse practitioners. These barriers exist across the state, but fall more heavily on citizens who live in rural and other medically underserved areas of our state, the same citizens whose health disparities are greatest and whose economic situations are the most precarious. They face significant risks in their health already. Barriers to care from APRN should not be an additional hurdle for them. The SAVE Act will increase access to health care at a time when our state is facing provider shortages, provider maldistribution, and transformation of delivery systems like Medicaid. As legislators, we must do all we can to expunge outdated laws that cripple our ability to respond to challenges like these. North Carolina is not a leader in this area. 22 states and the District of Columbia have already repealed outdated laws like ours, but we certainly should not be the last to make this common sense regulatory reform. We should make policy decisions like the SAVE Act proposes based on truth and facts, not misinformation and fear. And the truth is that decades of evidence does not support physician supervision of APRNs as a way to increase quality outcomes or improve the safe delivery of care. It simply is not true. You have heard these misrepresentations before, and you will absolutely hear them again. Hearing the same fear-based information does not make it true. I encourage the media and my fellow legislators to ask the carriers of these tales to show you evidence to support their claims. And the money I mentioned earlier in my remarks is not the higher earning potential of APRNs if the SAVE Act passes. It's about the income loss that many physicians will face if they are no longer able to charge nurse practitioners and certified nurse midwives large sums for the physician supervision that current law requires, although these physicians are supervisors in name only. They know it, we know it, and I want you to know it. Our state subsidizes the education of APRNs in the UNC system. Under current state law, North Carolina taxpayers are getting a raw deal on their investment because APRNs are not able to fully use their education. With the same master's education and national certification that I have right now as a UNC Chapel Hill graduate and a family nurse practitioner of 32 years, I am not able to practice fully in North Carolina as fully as if I went to Arizona, New Mexico, or 20 other states. I want to thank the other bill sponsors and our community partners like AARP who recognize that the SAVE Act is one common sense solution to our access to care problem. It's a step we need to take on behalf of the citizens that we all serve. Thank you.
Two other things I want to hit before we go into questioning. Just note that when Arizona passed similar legislation, what they saw in their rural areas of the state, visits performed by nurse practitioners went up 73% in 5-year period. And I know that many of you saw when Dr. Chris Conover last year did the economic statements on this change in allowance, and he estimated the annual cost savings to our health system as a range between $433 million and $4.3 billion in cost to our health savings system. So be happy to answer any questions you may have. I know several of the sponsors are here. Be glad to do that, and we have several organizations that are here with us today as well. In the Senate, it was just filed before we came down as Senate Bill 143. The companion in the House is House Bill 185. I believe those that came out with previously are the most update we have that's coming in for running that study. I know he continues to work on the field, but I don't have to. This would come into effective, the changes would come into effect immediately, and for the requirements, the licensing regulations would go as licensing turns over in the process. It is not. We're coming in. We have some other things have been put out by groups such as the Medical Society and others requirements, and I'll just say that I encourage the Medical Society and others, it's time to come to the table. The healthcare system is changing and is already moving towards emphasizing more nurses in their practices, in their roles. Hospitals are putting more nurses into these roles and practices, and quite frankly, it's time for the anesthesiologist and the Medical Society to come to the table and complete this issue. Go ahead.
Thank you for answering that question. So here we are doing Medicaid transformation when we're going to add, if we're lucky, 300,000 to 500,000 people to the insurance rolls. We need every provider we can get on deck working to the top of their license. So in my opinion, and I'll let my other bill sponsors weigh, but in my opinion, it's the perfect time to pass this bill in tandem with Medicaid expansion. But even without that, we have people out in our rural communities and even in downtown Raleigh who have insurance, and they can't find a provider to see because the providers are so inundated because there aren't enough of them. So I am a little concerned about when I hear people say it's not the right time. I think sometimes that's been used over the years as not by you necessarily, but as a stall tactic. And the truth of the matter is this isn't going to cost the state any money. This is a matter of a stroke of a pen, and these practitioners can be out there taking care of more people than they're able to right now.
I'll just, thank you for the question. We only get, as you know, one long session every 2 years, so you're going to see a lot of bills be filed. Right now, each and every one of these bills, whatever they may be, are on an individual basis. There have not been talks of putting bills together or trying to figure out a way to thread the needle on those several different issues. But the session's early, so you never know.
And just to add to that a little bit, no matter how you phrase the problems with health care or the type of insurance or type of coverage that someone has, if there's not practitioners, none of that matters. And this is addressing the changing populations and the changing needs of the state of North Carolina. Regardless of how people are insured or covered or what agreements are made on that, ultimately, we can't stick our head in the sand and pretend like the landscape isn't changing in North Carolina. Right now, a physician going through UNC Health, for example, there is about a 16% chance that they will practice in a rural part of North Carolina. That's what's coming in. A nurse who graduates from a community college in North Carolina has an 89% chance of practicing in a rural area in the state of North Carolina if that's where they went to school. So this is how we address that issue specifically. We're going to take up a lot, there's going to be a lot of healthcare discussions going on. This stands alone as probably the foundation of anything we may do.
Rose, about this bill in particular or just in general? There's always conversations going on. I try to bring as many people to the table as we can, and we'll try to find common ground. But sometimes you just agree to disagree and go work on other issues that you can't agree on. So conversations are always going on. But as you know, this is one that a lot of people have strong opinions about. Yeah. All I can tell you, and I think I can speak for Senator Heiss as well, this is not a symbolic gesture. We are committed to seeing this bill get to the governor and to be signed. Because when you come from where we come from, we don't have that luxury. We have to get any kind of access that we can get, as long as the quality's there, as long as the costs go down, and evidence has shown that quality does not go down when you reduce these burdensome regulations. So it's not a symbolic gesture. We are committed to seeing this bill become law.
Any other questions? Again, we're glad to have AARP on board this time and supporting this. We're glad to the showing of nurses we have out today. I heard 160 some are down here today trying to get co-sponsors for this bill and asking for those requests. So we've got a lot of work left to do, but I feel good about the position this bill's in.
I'll just say these are not fly-by-night groups. These are credible groups across the country and across our state. And anytime groups like AARP or hospice is willing to get behind a bill, it gives it that much more credibility to help us get it across the finish line.
Rose, I would add to that these are the very groups that are suffering the most from lack of access. And, those of us we're all aging every day, and we know what's coming at us, the gray tsunami. I mean, it's bad enough right now, but in the next 20 years are really going to be telling. So these groups have a lot of skin in the game to get this done. And many of them already see nurse practitioners and get their care from them, and they know what they're getting into. They know the high quality that these practitioners provide. So.
I'm here for the North Carolina Citizens for Public Health, and I would just say we are supporting this bill because we see the places, the health departments, the rural health clinics, nursing homes, where people just do not have the access to care. And we've come on board because we really want to improve access. Kathy Johnson. Okay.
Rose, I would just like to add to that a little bit. My name's Frances Messer, and I'm the president and CEO of the North Carolina Assisted Living Association. And we represent almost 15,000 residents in our assisted living communities across the state of North Carolina. And 85% of those residents every day are served by advanced practice nurses, nurse practitioners who go to the communities and they can visit the resident there in their apartment. The family is able to be involved and visit there. And then the team members, the staff who are there, can get firsthand instructions from the nurse practitioner. It's just been a really great relationship, and the quality of care has improved, and also the access of our residents in our assisted living communities.
Any other questions? Thank you all for coming out.